Welcome back. We are still here with our friend and colleague, Dr. Dale Bredesen, and we're talking about his program, The End of Alzheimer's. We talked about his book, probably a year ago, at least, and now we're talking about the program. This is the how-to, and we're just having so much fun. Well, I'm having fun because I like to geek out on this stuff as a neurosurgical ICU nurse. So this is just so interesting. But for me, this is personal, Dr. Bredesen, because as someone whose father was misdiagnosed, and when we got him on the right medications and off the wrong medications and got him doing a program that's actually very similar to yours, very similar to what you talk about before I even knew you, he radically transformed his life and was preaching and doing all-day seminars within a matter of months. So talk to us about what's in this program that can literally give people their lives back.
Right. So we have just followed in this program directly from the test tube. What are the things that drive the underlying pathophysiology of Alzheimer's? So you can literally follow, as I mentioned before, you can follow nuclear factor kappa B as an example. Anything that's causing inflammation from oral bacteria like P. gingivalis or T. denticola or F. nucleatum to herpes simplex to molds that can collect in your sinuses to, of course, HHV6A is another herpes virus that can get into your brains. As you know, the studies of brains even include candida, finding candida in the brain. So identifying the things that are driving the process, and then simply changing that ratio of the APP signal. So you're changing from a synaptoclastic signaling where you're pulling back based on these various factors to a synaptoblastic signaling where you are growing forward, making and keeping connections. And so we start by looking at what are the dominant ones and what subtype. When you start looking, you can see that there are these subtypes of Alzheimer's disease, and then you want to address those. So for this book, I actually worked with two other people, so I'm very excited to do this with Julie G., who is a user, who's actually been using this and has gone from 35th percentile on cognitive scores to 98th percentile. She's an ApoE44 with a strong family history. She's now been on 8 years, doing extremely well. And so she has all sorts of workarounds and things that she's done that have been very helpful. And then my wife, Dr. Aida Lasheen Bredesen, who is an integrative practitioner. So what do? You actually have to look at, is there ongoing inflammation? And so you then want to address that inflammation. Of course, leaky gut is a huge issue, making sure that you have the appropriate microbiome. And of course, the microbiome is different in Alzheimer's disease on average than it is in control patients who don't have Alzheimer's disease. And then it is supporting insulin sensitivity. It is inducing some mild ketosis because, of course, as your SPECT scans show, Daniel, there is an energy failure in the brains of patients with Alzheimer's. And for about 10 years before Alzheimer's is diagnosed. So we want to get in early. We want to support the energy. One of the things that's come out in the last several years is how incredibly common nocturnal hypoxia is in these patients. So patients who are beginning to have cognitive decline.
Well, it's one of our big risk factors, right?
Exactly.
So what I hear you saying, and I'm almost listening to myself, except you say it in a more
you guys are very similar
way, is the first thing to do is know your important health numbers. Yes. That's the first thing. And the famous business consultant said, you can't change what you don't measure. Peter Drucker said, you can't change what you don't measure. And I heard you say, well, we need to check for inflammation.
Yes.
And so we use C-reactive protein. Yep. There are other ways to check for it.
Well, one thing that I heard him say, and I want to bring this up because all of our Brainiac friends that are on our show say the same thing. And this is just so important because I know people still get tripped up by this. All of the brain doctors on our show, including us, the gut. It's the gut, like the gut-brain connection. It's one of the things we have to pay attention to.
From a practical standpoint, people should be getting their important numbers checked, likely on a yearly basis. So some measure of inflammation. What else do you use to test for inflammation?
Yeah, we often use albumin to globulin ratio. It's a time-honored and inexpensive way to get at the same thing. Sometimes TNF, so tumor necrosis factor alpha, and interleukin 6 and interleukin 8 are both increased. Often, again, in an inflammatory state. And then, of course, for people who have inflammation with respect to the innate immune system, you can look at things like C4A, or TGF beta 1. Those are also good ones to look at. And one of the interesting things, as you know, that's come up with COVID-19 is that COVID-19 and Alzheimer's have many parallels. And in fact, many of these comorbidities we talk about with Alzheimer's as risk factors are comorbidities that predict a poor outcome from COVID-19. But instead of over 20 years, everything's compressed into 2 weeks. So things like low zinc, low vitamin D, obesity, type 2 diabetes, hypertension. These are all important in Alzheimer's. They are also important in COVID-19. So we want to look at these.
Yeah, so interesting.
Your best defense against COVID-19 is your immune system.
Exactly right. And the innate. Yes.
So inflammation, also omega-3 index, because
Absolutely.
we did a study, 49 out of 50 consecutive patients had suboptimal levels of omega-3 fatty acids, which can increase inflammation. You also said, I have a meeting with my dentist next week, that gum disease is a major cause of inflammation. So taking care of your teeth is absolutely
well. And so many people think, oh, well, if I just eat right. When I met you, I'm not a nurse, and I went to Loma Linda, where they're very nutrition conscious. And when I met you, my omega-3 fatty acid ratio was horrific, and my vitamin D was like 17. And I'm like, well, how is that possible? So,
because you can't change what you don't measure.
Right.
Yeah, absolutely.
And so in the end of Alzheimer's program, you tell people what lab tests that they should get so that, you mentioned infections like herpes 6. So many people are positive.
Mm-hmm.
How do you know, just because you've been exposed in the past, so you have IgG antibodies to whether it's herpes, whichever one, or CMV or Epstein-Barr, how do you know if it's significant and you should talk to your doctor about treating it?
Mm-hmm.
It's a great point, Daniel. And with HHV6, there is HHV6A and HHV6B. And most of us are positive and have been exposed to HHV6B. The one that is more associated with cognitive decline is HHV6A. Now they're just, in the research studies, they're just beginning to look at the ability to distinguish these. Right now, you're right. If you get HHV6 antibodies, they're going to be to both. They don't distinguish between A and B. Fairly soon, you will be able to distinguish those. And the big one to worry about is HHV6A. So, and this comes back to the idea that, it's the innate system, both in COVID-19, where we're dying of cytokine storms, and in Alzheimer's, where part of the innate immune system is A beta. So you're making this amyloid as part of your innate immune system's response to these various pathogens or insults. But there's the inability to hand off to the adaptive system, your T cells and B cells, and the more modern part of your system, which then turns off the innate system. So the problem is, as long as you don't turn this off, and of course, some of the things that are abnormal in Alzheimer's patients, where they can't turn this off and they don't have an appropriate adaptive response, happen to be things like low omega-3s, just what you talked about, and low vitamin D. These are absolutely crucial for the ability of our adaptive systems to become active. And part of what they do then, not only attack the pathogens and clear them, but they also come feed back and turn off that innate system that is giving you that chronic inflammation that is giving you Alzheimer's disease. So that's a critical part, supporting that handoff.
All right. This is so interesting. Yeah. I mean, it's really groundbreaking work. Know your important health numbers. Optimize them. I think optimizing them You know, I wrote a book called The End of Mental Illness, and we just have the wrong paradigm. It's not mental illness, it's brain health. And I actually got the idea from that I wrote a book in 2004 called Preventing Alzheimer's, which is basically, if you want to do that, you have to prevent all the risk factors. So the synergy between our work. But as I wrote that, I'm like, oh, that's also how you prevent depression. That's also how you prevent ADHD or anxiety disorders. It's, get the brain right. Your mind is better. Your cognitive function is better. Your marriage is better. Right. So your program, yes, it's about cognitive decline, but it's also about mood decline. And it's also, ultimately get your brain right. Everything in your life tends to be better. All right, when we come back, we're going to talk more about the practical application of the End of Alzheimer's program. And we're going to talk about the types of Alzheimer's disease. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.